We have more anaesthetic backup than many hospitals throughout the country who are still on call. And that's something that's never been highlighted. We have more anaesthetic backup than Ennis Hospital. We have more anaesthetic backup than Nina, than Mallow, than Ballinasloe. And they're just to name but a few. And yet still, somebody decided that we shouldn't go back on call for our surgical service. And that's what led to the death of Patrick Joe Walsh.
Good evening. The family of a 76-year-old man who bled to death in Monaghan General Hospital say they want the Minister for Health and the Health Service Executive to tell them why he couldn't be saved. Patrick Walsh from Killanny near Carrickmacross died from a bleeding ulcer because surgeons in Monaghan are not allowed to perform emergency surgery.
Good evening and welcome. The family of 75-year-old Patrick Walsh, who bled to death in Monaghan Hospital last Friday, say they're stunned and angry by today's announcement by Mary Harney that a bed had been available in the intensive care unit in Cavan General when he needed to be transferred there.
I have now been informed that there was an intensive care bed vacant in Cavan General Hospital when Mr Walsh needed to be transferred.
The fact of the matter is that there was no room at the inn for Pat Joe Walsh. When Monaghan inquired from Cavan, from Drogheda and from Beaumont, there was no room at any inn.
The surgeons in that hospital, excellent record with an expert support staff and a state-of-the-art theatre, could not operate on them because of protocols, because of the exercise of policy that you and your government have imposed on the health services in this state.
But no matter what services are available, what I don't understand is if you have somebody on duty in Monaghan with a very sick man who needs surgery in Cavan, why were they told there were no beds available?
Because we don't know what the communication lines were between the two.
But the family we just heard, they were told that they had phoned up and that, for instance, there was no intensive care bed available in Cavan.
You've got to remember that we've got to be able to access acute services, and all local hospitals, we're not looking for major A&Es, we're not looking to deal with trauma, we're not looking to do brain surgery, anything major. We want to be able to provide for the majority of the acute problems that the patients in the area present with.
Fair and square. Save our lives. That's what it needs to be. Everybody. Ladies and gentlemen, let's welcome the card.
We're here for a very, very simple reason, in that any local hospital needs continuity in terms of acute medical, acute surgical and accident emergency services. Now, in times of poverty and hardship in this country, we have been able to sustain a local hospital in Monaghan, among other counties, Roscommon, Lover and Ballina, down in Clonmel, Mallow. I do not see why we cannot now.
Hold that. That's lovely.
People of Monaghan don't mind coming out on a cold, blustery night to stand for an hour or 2 hours in the freezing cold to get the message back to Dublin that we need our hospital, that we will keep going until we get that hospital.